Okay, so just a quick one. We said a person who suffers from cretinism is called a cretin, and iodine deficiency is going to cause the swelling of the thyroid gland, and it is going to lead to a condition that we call goiter. All right, now I want us to move on to another gland, which is the adrenal gland. So this adrenal gland is a pair of glands that is located just above each kidney. So the medulla of the adrenal gland produces a hormone that we call adrenaline. So this adrenaline as a hormone is called the fight or flight hormone. So it is produced when an individual is angry, or when the individual is scared, when the individual is emotionally excited or under stress. So this hormone, which is the adrenaline hormone, is going to prepare the body in the following ways. Number one, it helps to boost the changing of glycogen to glucose. So thereby, this is going to increase the glucose levels in the blood to be used for respiration. Remember we said glucose is used as a substrate for respiration. Now, another way this adrenaline is important is it increases the breathing rate so that more oxygen is taken in to be used for energy production. Another importance is that it increases the heart rate so that more blood containing glucose and oxygen can be carried to the muscles. All right, apart from that, this adrenaline hormone helps to divert blood from the gut to the muscles by constricting the blood vessels of the gut and dilating the blood vessels of the muscles. Apart from that, it helps to dilate the pupils in the eyes for increased alertness. All right. Another importance is it helps to dilate the bronchi and increases the volume of the thorax so that more air containing oxygen may be taken in. Apart from that, it also helps to increase the sensitivity of the nervous system for faster response to a stimuli. Apart from that, it raises the hair in furry animals and causes the appearance of goose bumps. All right. And then the last one is this adrenaline hormone is going to prepare the body by simply causing the body to shiver. So it is going to promote shivering of the body. Good. Having that said, let's move on to another gland, which is the pancreas. So I love the pancreas because the pancreas is both an endocrine and an exocrine gland. So it is considered as an exocrine gland in the digestive system, where it is going to help produce pancreatic juice. All right. Remember last time in our topic for the digestive system, we said pancreatic juice contains pancreatic amylase, pancreatic trypsin, and pancreatic lipase. So that is what the pancreas does, right? So as an exocrine gland, it produces pancreatic juice. Now as an endocrine gland, it plays a major role in normal glucose levels in the blood. How? It has cells that we call the islet of Langerhans, which are going to produce hormones that are involved in sugar regulation. So these cells are two types. We have the alpha cells and the beta cells. So the alpha cells are going to secrete a hormone that we call glucagon, and we know the function of the glucagon. Glucagon helps to convert the stored glycogen back into glucose, right? Then the beta cells are going to secrete a hormone that is called insulin. So this insulin is going to help to convert the high or excess glucose into glycogen. So let's imagine a simple example as when we talk about insulin and glucagon, so we have too much sugar. When you take too much sugar in your body, that too much sugar has to be made to be less too much sugar, right? So that means that too much sugar has to be converted into glycogen, which is less too much sugar. And then when your body is lacking energy, that less too much sugar has to be converted back into too much sugar, which is excess glucose. Now I've complicated the term, so just know that the insulin hormone is going to help to convert excess glucose into glycogen. Then the glucagon hormone is going to help to convert the stored glycogen back into glucose. All right, so moving on, we have, where are we? All right, okay, let me read through these points. So these hormones that we have mentioned, the pancreas, it is going to cause the cells of the liver and the muscles to convert glucose to glycogen, which is stored in the liver and the muscles. The body can only store about 400 grams of glycogen, and about 100 grams is in the liver and 300 grams is in the muscles. All right, so the pancreas, as an exocrine gland, we said it helps to produce pancreatic juice, but as an endocrine gland, it is producing all these effects where the excess glucose has to be stored or converted into glycogen by the insulin hormone. And when we are dealing with the excess glycogen being converted back into glucose, this one is done by the glucagon hormone. So it causes the cells of the adipose tissue to convert excess glucose to fats. So the fats are stored under the skin and around the delicate body organs such as the heart, the liver, and the kidneys, the intestines, and the brain. So this is to prevent shock, right? So those fats are acting as shock absorbers. So moving on, it enables the body cells to absorb glucose from the blood and to use it. So lack or insufficient production of insulin leads to a disease called diabetes mellitus, whose signs and symptoms are as follows. There is abnormal high levels of glucose in the blood. There is the presence of glucose in the urine. Then there is persistent thirst leading to excess intake of water. Then there is drastic loss of weight. Then there is loss of sensation in some of the body parts. No wonder when a patient has this condition of diabetes mellitus, and if it's in extreme conditions, they could have a very big wound. You as an attending physician, you as a nurse, as you are trying to clean the wound for that person, you discover to say they are not having any pain at all. They are not expressing that kind of pain. Why? We are having that loss of sensation in some of the body parts. So when the glucose levels are too low in the blood, the pancreas detects and secretes glucagon, which increases the glucose levels in the blood in the following ways. Number one, it causes the cells of the liver and the muscles to convert glycogen to glucose. Apart from that, it also causes fat to be changed into glucose, and it may cause proteins to be modified so that they are utilized for energy production. Alright, having that said, let's talk a little bit about the negative feedback mechanism. So under the negative feedback mechanism, we know to say a monitor or a detector is used. Just like we said, when there is less glucose in the body, the person is going to release the hormone that is going to the glucagon, which is going to help convert the stored glycogen back into glucose. But when there is so much glucose in the body, the insulin is going to convert the glucose into